Today's medical-centric topic is frozen shoulder versus rotator cuff tear. How to clinically tell the difference. Why these two conditions are often confused. Frozen shoulder and rotator cuff tears both cause shoulder pain and limited movement, which is why patients, and even clinicians early on, often mix them up. But clinically, they behave very differently. What is frozen shoulder? Adhesive capsulitis. Frozen shoulder is a condition where the shoulder capsule becomes inflamed, thickened, and stiff. It commonly affects people between 40 and 60, especially those with diabetes, thyroid disorders, or prolonged shoulder immobilization. What is a rotator cuff tear? A rotator cuff tear involves damage to one or more of the rotator cuff tendons, usually from trauma, overuse, or degeneration. It is more common in people over 40 but can also occur in younger individuals after injury. Pain pattern. How it feels. Frozen shoulder causes a deep, constant ache, often worse at night and unrelated to specific movements. Rotator cuff tears cause movement-related pain, especially during overhead activities or lifting the arm away from the body. Range of motion, the biggest clinical clue. In frozen shoulder, both active and passive movements are restricted. Even when the doctor moves the arm, it won't go far. In rotator cuff tears, active movement is limited, but passive movement is relatively preserved. The arm can be moved when assisted. Strength testing differences. Frozen shoulder usually has near normal strength, but movement is blocked by stiffness. Rotator cuff tears show true weakness, especially in abduction and external rotation. Onset and progression. Frozen shoulder develops gradually, often without clear injury, and progresses through freezing, frozen, and thawing stages. Rotator cuff tears often start suddenly after strain or trauma, or worsen gradually with repetitive use. Imaging. What helps confirm the diagnosis? X-rays are usually normal in frozen shoulder and mainly rule out arthritis. Ultrasound or MRI is useful for detecting rotator cuff tears, tendon retraction, or muscle atrophy. Response to injection. In frozen shoulder, steroid injections often give pain relief but slow improvement in motion. In rotator cuff tears, injections may reduce pain but do not restore strength. Why correct diagnosis matters. Frozen shoulder is usually self-limiting and improves with time and physiotherapy. Rotator cuff tears may worsen if untreated and sometimes require early surgical referral. Clinical takeaway. If passive movement is also restricted, think frozen shoulder. If passive movement is preserved but strength is lost, think rotator cuff tear. This simple distinction can prevent delayed treatment and long-term disability.
Thank you for watching our video. Please do not forget to like and share the video. Also, please subscribe to the channel to stay updated on our latest videos.